Welcome to the Infosys Healthcare and Life Sciences Perspectives, the podcast and video interview series with thought leaders.
All right, very good morning and welcome to another edition of our podcast series. We're very happy and fortunate to have Venki Anand, our global head for healthcare. One of the topics on this edition we want to touch upon is telemedicine. It's a very fascinating subject. Something which has been there for some time, but yet not really been as permeative as other technologies that we're talking about. So, Venki, welcome to this edition of our podcast. I know telemedicine is something we've been talking about for some time. It's been in the news, but it doesn't seem really scale up as much as it ought to be. And why do you think is the situation?
Yeah, first of all, thanks for having me. And it's a great question. While the benefits of telehealth is well understood, there is clear evidence that it's a great technology that can be incorporated in healthcare. The adoption is still not as much as one would like it to be. But if you look at data, in the last 5 years alone, back in about 2015, we used to have about 5% adoption by physicians in telehealth. Now in about 4-5 years now, we have about 22% of adoption. So it is increasing. But having said that, technology has much more progress than the adoption rates by physicians. And there are two main challenges. One is from a people and chain management perspective. The second dimension is the regulatory aspect. But having said that, any physician or any practice that has adopted this definitely sees the benefits and they are continuing to evolve and adopt. But having said that, what we really need to think about is to how do you bring in a systemic change and structural interventions into workflows of physicians? How do you make it comfortable for them? How can we design workflows so that it is natural for physicians to have telehealth as another channel of delivering care? That's really the shift that we need to do to kind of bring this change at scale. That's really how I think about it. But nevertheless, I think we're getting there because, as I said, statistically, there's a 4x increase in adoption by physicians in the last 4-5 years alone. So that's clear evidence.
Great. I think you make a valid point in terms of the shift and the change. Is it largely also to do with the more cultural, behavioral aspect from a patient perspective, not just about the patient?
Sure.
Is that also really curtailed the adoption in the large sense in terms of telemedicine or telehealth, as we call it?
Yeah, most definitely. From a patient perspective, obviously it's a big change. Again, a lot of patients understand the benefits of it. Who wouldn't like it? For example, I was looking at another piece of data. On an average, if you decide to go and have an in-person consultation, the typical time that it takes is about 122 minutes. Whereas in a telehealth model, it's about 6 minutes. Right? So it cuts off all the wait time, the need to call, get an appointment, the need for the physician practice to call you back and say, hey, by the way, Mr. Joe, your appointment is tomorrow and it's at so-and-so time. Can you please confirm? If you take the whole cycle, it's about 122 minutes. So it is a no-brainer, right? But nevertheless, the general perception is that in-person is always better, which in certain situations is definitely true. But having said that, for simple things like a post follow-up, a non-ER visit or a non-emergency visit, simple symptoms like flu, etc., patients also understand that it is a great alternative. Physicians understand it. And these are, in my opinion, great starting points to actually drive telehealth as the primary mode of clinical care rather than in person. Right? So that's really how I think about it.
I think you make a very valid point. Again, telehealth or telemedicine is more of an initial interaction with the doctor, but not necessarily. There's a lot of skepticism saying that there's not really a serious surgery or serious meeting.
Right.
Is that actually also weighing in people's mind in terms of adopting that?
There is, but then I would like to give you another interesting experience or a project that Mayo Clinic did. with the neonatal space. They called it a neonatal program, where they were able to deliver skills that are very specialized in the neonatal space, where this was for remote areas where it's very hard to get there. Weather conditions, geographical reach, etc., is hard. But a bunch of community care members were given direction by the specialized team through a remote in a remote model. So there are, these are very specific programs that are in the early stages of adoption. But nevertheless, I think it bridges time, space, and geography kind of challenges for delivering very specialized healthcare clinical delivery to this population.
Segment.
Yeah.
Very interesting perspective, Venki. One of the things that's really the telemedicine, telehealth will talk about, not about the patients as well as the hospitals and the physicians, but the entire cost itself can be a huge gainer for the entire system.
Yeah.
Is that an increasingly angle that we should be looking into adoption?
Sure. Now, I look at it from two dimensions. One is definitely care costs are dramatically different in terms of being lower than in person. The second aspect is the major gap that we have today between supply and demand, right? So demand far exceeds the supply that we have in terms of physicians, etc. So in a telehealth model, the productivity will be far higher because you're able to now cater to, as a physician, you can be much more productive if you have telehealth as part of your workflow. So I believe, and therefore the overall cost at a scale would be much lower. So absolutely. So telehealth will definitely bring down costs while addressing the gap that we have between the supply and demand in terms of clinical service available to the larger population.
Correct. And one other common perception is it's not necessarily the best mode of doctor appointment or medical treatment for critical conditions.
Right.
Is that something people are looking into it, or is there a regulatory viewpoint on this aspect? If you can shed some light on that part of it.
From a regulation angle, while it is still not incomplete, it hasn't completely bloomed in terms of aligning with telehealth models. I should say it is very encouraging. For example, last year there was a new mandate from Medicare where for chronic care conditions, Medicare did support telehealth models. This year, in October 2019, California, for example, passed two bills that supports expansion of telehealth models to either deliver prescriptions or, for that matter, drive parity on payouts, from payers, be it a telehealth model or, for that matter, an in-person model. So from that perspective, legislation is definitely keeping up. And I'm very confident that it is only going to go up because this is a model that is the future. No question about it.
No, I think you again raise right points. So the other common thing that keeps coming to everybody's mind is the infrastructure. Now, infrastructure, it's no brainer that it reduces the cost, it makes productivity high with the physicians. But are we really have that infrastructure equipped to do that? I'm not even talking about just from the provider's side, but even as an end consumer, do I need to be really equipped in terms of a larger infrastructure to actually make this model work?
Sure.
Is that again a concern? Is that something that really also...
It's definitely a concern. And in fact, interestingly, FCC planned on a major investments on how to upgrade infrastructure, particularly in remote areas where broadband continues to be a challenge in the country, primarily to support telehealth. So that's definitely a problem today. But having said that, I think there are right investments that are being made to kind of bring in that infrastructure support. Having said that, even on the private side, there are some very interesting developments. For example, Walmart stepped in and said that in rural areas or remote areas, they could, members or patients could actually leverage the broadband networks that the stores have, so that if you or I don't have a proper broadband network to support a telehealth model, getting care at my home, I could walk into my nearest Walmart and actually use the broadband network of the store to actually connect in. So these are models that are evolving. So it's a public-private partnership that's evolving to support a business model like this. So I think we're in early stages of adoption again, but I think we'll get momentum on this.
Right. And I think you bring a great point on public-private partnership. I know the costs and talking about the various players, the telecom players can come into the picture. Do you increasingly see non-traditional companies getting into this model and then integrating with the core healthcare providers? Is that something that's going to be panning out in the near future?
Sure. Look, with the expanse of 5G networks, etc., you have large telco players increasingly to the mix, and so today healthcare delivery is a much fragmented model, but with the integration of infrastructure like a 5G, it can be much more experiential. It can even the telehealth model today is a video. But if you bring in technologies like AR, VR kind of a concept, Absolutely. Which needs much robust infrastructure supported by large telco players, it's going to make that experience much more richer. That's really where the future is going.
Wonderful. My last question. I mean, companies like us, Infosys, they've been increasingly putting technology in the actual sphere of healthcare. We really see that in an aspect of telemedicine, telehealth with our partnerships that we're doing. Is that something we are robust on that? You have a point on that?
The way we think about it is, like you earlier asked, this is multiple industries coming together to deliver to the member or the patient, right? So you have constituents, the traditional constituents like your provider or physician, you have the payer, then you have the member, and then you have the underlying infrastructure that needs to come into play, supported by a very robust technology that is seamless, because experience is key here. Process is very key because you have to bring in adoption. So to orchestrate all this, that's where we see a seminal role in terms of bringing all the constituents together and making telehealth a reality in healthcare. That's really how we see it.
Wonderful. Thank you so much, Venki, again for your time.
Sure.
Great insights, great perspectives. We'll look forward for another edition of our podcast series. Thanks again, Venki, for your time.
Thanks for having me.
All right.